you wish to start with diabetes 1?
I mean, yeah, we can start with that. So because I'm more familiar with that. So yeah.
Yeah. So with the diabetes type 1 is in terms of the Ayurveda is mainly based on an inflammatory process. This inflammatory process can have different reasons. It's more likely, in most patients, I would think, is related to genetic things, genetic or inheritance. Also, the Ayurveda speaks about this, that there are things that we take from our past generations. So it's about karma. However, the main pathophysiological thing is Pitta, which is then aggravated by Vata, meaning stress, not healthy lifestyle, moving a lot around, anxiety, an unsafe environment. So these two factors come together, and then what happens is that we lose via the urine. That is the concept. The Prameha, so the altered urine. That is the Sanskrit concept. The Prameha. And we lose the Ojas. Ojas is basically our life essence, the life energy. This is the Ojas. So we lose it with the urine. So that is the concept in Ayurveda. So when we look at the treatment, unfortunately, also the Ayurveda cannot heal the type 1 diabetes. However, the usage of the insulin can be dramatically reduced. And for that we need to.
And my question is, because you said Ayurveda cannot heal diabetes type 1, and it maybe can heal diabetes type 2. So how is what is the process, or how Ayurveda think or believes that it's not curable?
Because the origin is something that is not maybe in the present life. It depends a little bit. It depends if we have toxins, for examples, or if you have environmental factors that may also lead. Then, of course, if we handle these factors, we can revert these symptoms. But if it's a really inborn error, it's not so easy to cure. But the Ayurveda really much helps to get along with it and to take care of it. So that the insulin, in the modern concept, the insulin concept or the insulin intake is reduced significantly. Because what we know is that although the insulin is necessary, we know that in the modern concept, or that's what I also learned, is that the insulin on the one hand is helping, but also the other hand has not such a good impact on the longevity of. So the less insulin we take or you use as a type 1, the better it is.
Yeah.
So the main origin is the Pitta, and it can be handled by controlling the driving force, which is the Vata. So the stress, lifestyle, nutrition is a very, very important thing. And on the other hand, the type 2 diabetes is mainly a kapha situation. So it's related to obesity, malnutrition, lack of movement, but also environmental factors that contribute to an increase in kapha in this dosha. And from there it develops gradually. So in terms of the type 2 diabetes, the Ayurveda for sure is able to cure or to completely revert the situation when we are treating early. So that's something that we can do in the type 2 diabetes.
And so, and the treatment is about, I mean, get out of the inflammation.
Well, in a type 2 diabetes, the inflammation is not the primary problem.
Okay.
It's not the primary problem. It's a secondary. It's something that happens later on, but it's not the primary problem.
Okay.
In type 1, the pitta is the origin, is the dosha that is really under observance.
Okay.
Yeah. And that's something which we need to it's hard to control, unfortunately. It is possible to control, but we cannot really cure. Well, as far as I know. I mean, maybe there's some Ayurvedic Vaidyas that maybe can do this, but as far as I know, it's not so easy to cure, or it's not, well, I have never seen someone being cured. But I wouldn't say that it is impossible when you go to India and find some Vaidya that is, really, maybe that's possible.
You're saying, are you talking about type 1?
Type 1. That is type 1. Type 2 is a complete different story.
Yeah, I know. Yeah. So for example, you as a doctor or Ayurvedic doctor, imagine that, okay, I came to you and I said, okay, I have type 2 diabetes.
Yes.
But how can you help me, or what can I do for, imagine, okay, I need to release 10 kilos or 20 kilos or whatever. I mean, it depends on each person, and to heal myself. And I mean, what is the things that you're looking at? And then
yes, we need to look at, first of all, because I would say, maybe you are much more in this diabetic, what I see is in 80 to 90, even almost 100% of the people that come with a type 2 diabetes or a late onset type 1, if it's not a late onset type 1 diabetes, so with the classical type 2, people are always overweight, obese. And or are confronted with issues that are related to a very bad digestion. So that could be related to food, but also could be related to trauma.
Yeah. Digesting life. So the things that happen.
Exactly. Yeah. And that in the end will be the result will be an increase of body mass because of different mechanisms.
Yeah.
Okay. And that has to be analyzed. So the thing is, the obesity as such is a symptom that can result for psychological issues or stress related, in order to give the body more stability. So people tend to eat the wrong things in the wrong way, and then with the genetical predisposition, people develop diabetes, or they lose that what is too much in the body with the urine, the Madhumeha. So sweet urine, that's what we see also in the Ayurveda, the symptom is Madhumeha. So basically the idea is to get rid of the obesity, so to reduce weight. This is the main thing.
Yeah.
But to do that, we have different ways to addressing that, depending on the reason why someone has too much weight. So not of course, eating is a problem, but someone eats because he's frustrated. Someone eats because he has some anxiety. Someone eats because he has moved to a new area. So there are different reasons why people are not eating properly all the right things.
And you, as a doctor, you will find out. You will ask questions to know more about it.
Exactly. Also, other underlying diseases. Also, really going through the lifestyle, going through the living condition, and the experience in the past, the family constellation. Everything is important to find out and to give the patient a way to change the nutrition and the lifestyle. So in Ayurveda, there's always three pillars: is the nutrition, the lifestyle, and then we have treatments and medications. And the treatment and medications are twofold: is cleansing, complete cleansing, and supporting. So we have Shodhana and Shamana. Shodhana is complete cleansing. Sometimes we need to clean a lot of things, and sometimes Shamana is already enough. So we give some powders, we give some pills, or we make smaller treatments that can end together with the food and the lifestyle already improve the situations. But sometimes, especially when we have long-lasting diseases, we need a cleansing, Shodhana. The most famous Shodhana is Panchakarma.
Okay. And this
So that would be
these products. I mean, this cleansing that you provide, or that you're saying, they are made with natural things, or they are with chemicals like the medicine?
no chemical. In Ayurveda, there are no chemicals existing. What we use, so in the classical Ayurveda, we have plant-based, but also we use minerals. So there's a special, like a trait of Ayurveda that use a lot of minerals, also heavy minerals, but they are specially prepared so that they do not harm the body. But basically everything is plant-based, animal-based, and or based on minerals.
Okay. Yeah. So
there's we don't use any.
Yeah. So depending on the story of the customer and the things that you're looking for, okay, this, I need to do this, and so you prepare this besides the food. But for example, you will also say to your customer, okay, so please do or eat this and this, like a nutritionist did, or I mean, just based on the food, what things do you advise, or do you say about it?
Well, with the people that have a kapha dominance, basically what we need to do is to give them regularity. So, and also to support the digestive process. So basically everything they eat should be well cooked. They should avoid raw food. They should avoid dry food. In order to support the digestive process in the body. So that is one of the most important things. And then what is also very important, and we really address this with the Ayurveda, is that between the meals, so actually a concept that is rather contradictory to modern diabetes concept is that you should not have a lot of meals in between, but just stick to 3, probably only 2 meals in the type 2 diabetes. Is very important. So the concept of having small things in between is not good. And then we should use a lot of herbs that also support the digestive process. like cumin, fenugreek, ajwain, anise, these things that also give kind of a bitter taste, because bitter taste improves the agni, the digestive process, and by that the kapha is reduced in these people.
Okay.
Yeah, so it's a little bit complex, but in the end it's easy to follow. So the background is a little bit complex, but the advice is quite easy, but sometimes for them it's not easy to follow, because they have their routines, they have their habits, and also, if someone has a lot of stress in the work, he tends to eat a lot to calm down. So he has to become aware of that and to change his lifestyle. Maybe he has to look for another job, or maybe it's always, things are always coming together. These three factors: nutrition, lifestyle, and then treatment, they all work together. If we only treat, only give powder, the effect is only very small.
Yeah.
But the things have to come together.
Yes,
and
for
then
sure.
Yeah. And with the type 1 diabetes, the lifestyle, so the Vata influence, so the movement, and is so important. So in type 1 diabetes, people need to have a very structured life, very clear, very structured. So the Vata has to be reduced. We are dealing with a safe environment. We are dealing with a clear routines in the day. We are dealing with clear sleep patterns. We are dealing with less traveling. We are dealing with an environment that is stable. So all these things contribute to an improvement of the type 1 diabetes situation. And then, of course, we are dealing with food. So we need to increase the part of fat for carbohydrates. So especially ghee is a central aspect of treating type 1 diabetes patients. So they should have a lot of ghee, because the ghee lowers the motility of the digestion, and by that also the release of carbohydrates into the bloodstream. So then also we are dealing with sugars that have a low glycemic index. We are dealing with a lot of dals, protein-rich, plant-based, protein-rich food. So nutrition plays a big role, but also the lifestyle. In type 1 diabetes, the lifestyle is very, very important, and reducing the inflammatory, let's say, influence on the body. So being in the direct hot sun is not very good for type 1 diabetes people. They should be warm, but never hot. Like drinking a lot of hot tea, for example, is not so good in type 1 diabetes.
Yeah, in fact, I don't like things. I don't like. In fact, I don't like hot tea. I usually prefer like warm, but not so hot. For me, I don't like it. My body doesn't really.
Yes, because there's already a lot of pitta in the body, and that needs to be, and you're losing your life, the ojas, and that has to be controlled. So let's say like this is, I cannot give you like a standardized plan. In Ayurveda, nothing is standardized, but the concept is always true, always valuable. But then from that we have to see the situation and the symptoms. It's very important, because in Ayurveda we treat symptoms. We don't treat diseases. We treat symptoms.
So beautiful, yeah.
Yeah, we don't treat, I don't, so when someone comes with, I have type 1 diabetes, can you give me something? Or what do I have to do? I said, okay, let's sit. I have to see you. I have to ask your lifestyle. How did it develop? Did you gain weight? Did you lose weight? What is the problem? How do you sleep? How's your digestion? Do you sweat a lot or not? Then for women, how is your period going? So all these kind of things come together, and then we make a plan. But the concept is to lower Pitta and Vata in the type 1. And in the type 2 is to take care of the Kapha and the Ama, the undigested material. So that is basically in rough
the
form.
differences, right? And the way diabetes is seen by the Ayurveda, looking at these things, and of course focusing on the customer and what is, because this customer is not equal to the other one, so they have different things.
And then we have a lot of drugs that can support the process, basically supporting the digestive, let's say, or the transformative aspect of nutrition. So because digestion is sometimes a little bit too rough, we are talking about also on the cellular levels, not only what's happening in the gut, but also what is happening in the cells with the energy. So there are a number of drugs or plants that we can use to do this, either plant-based, but also minerals-based.
Yeah. So what I'm getting is, because, for example, I'm also a therapist, and I work a lot on the emotional body, energetic body, doing family constellations. I mean, going to the origin of the symptom. I mean, find out, okay, you have this, what is the origin? It's just you, or it comes, where did this come from?
Yes.
And for me, it's really important, because it gives to the person more conscious that, okay, so I'm loyal to this, my ancestor, blah blah blah, we still have this, blah blah blah, so I can release. Okay, now I can make different decisions, and I can do different, and not staying with this just because. And of course, working else with the physical body and other things. So what I'm hearing is because, for example, you as a doctor or Ayurvedic doctor, maybe you are not going and into the traumas or into the emotional body. And
oh yes, we do. No, we do. Very important, we do.
Okay, so people can express, okay,
we do because
or sadness or fear because of this, and go deeper in finding, okay, so go.
No, that's something that supports the process. We are looking, no, that's for sure. We always look also on the mind, on the emotional things, and also to see what prevents them to take actions also. Sometimes people have problems to be very structured or to be disciplined because of things, and that's something we have to address and to make aware, and to that they start first to work on this, and then we're coming to other treatments. So no, we are absolutely looking on this. No, it's not only just
yeah, so that is good, because somehow you're not just focusing on one specific part of the body, or just one, so just the body, but looking more on the other parts of the person that is in front of you.
Yes. Because things are interconnected, they are interrelated. We look at the complete person, the body, the mind, the soul, and the senses. This is also very important.
Yeah, wonderful. Okay, and so in your experience as a doctor, and if you have worked with people with diabetes, I mean, what is the key, or the thing that makes, for example, a person who have type 2 kind of get healed and okay, I'm motivated, or I'll reverse it, or now my body is already okay, because I'm eating well, I will reduce my weight, and I'm living the way my soul wants to live. So what is the things that makes the person goes there and heal, or what is the things that, okay, no, that person will not be healed, because
I think for me, or it's very important that when I explain the cause of the symptoms or the disease someone is going through, from the Ayurvedic perspective, they understand why the things are there. So why everything is interconnected, why a lifestyle has to do with my nutrition, while my nutrition has to do with the symptoms, why my symptoms have to do with the environment I am. Am I in a hot environment? Am I in a cold environment? Is my house wet? Is my house dry? Is the country where I'm living, is it subtropical or tropical? All these things are connected, because as humans, we are always trying to find balance in reaction to things that come from outside, that we perceive with our senses. So when someone understands the interdependency of these things, people have possibilities to act. So, okay, because of this, it's this. Okay, in order to reverse this, I have to do this. And then they will see step by step the, let's say, the impact. So with small steps, they will see, okay, I'm doing this. It's improving. I'm doing this, is improving. So they will always see a small steps improvement. And that is very important in the whole process. We will not be able to give a pill and then everything's good. No, people have to improve continuously, and Ayurveda helps to initiate this process and to continue in this process.
Yes, of course. Yeah, it's not just the pill that, okay, today I'm going there and tomorrow, da-da!
But that's something now in the modern society, people expect this, because if you have pain, you take a painkiller, pain is gone. If you want to go to Lisbon, take a car, in 1 hour you're there. So this is the modern perspective. Things are fast. We lose patience, we lose awareness, and that is something also the Ayurveda takes care of.
So this is really important.
And especially in type 2 diabetes, in Ayurveda, we have a very nice pathophysiology that's always in six steps. So a disease develops in 6 steps, which are well defined. And the idea is to revert the process from the symptom, but also working on the origin, so that we are always going from both sides. And the more advanced in the disease process someone is, the more time we take to come back. But if we don't deal with the origin, and that origin may be also on the psychological, emotional side, the process will always be, we go down, but also will be pushed there. So we will not be able to really proceed there in reverting the process.
Yes, because you need to look at all these things that are maintaining the symptoms and the disease there, because if you're not looking at all parts of the person, or all bodies, or whatever the word that we can say, maybe there is still something that needs to be seen or addressed or somehow healed.
Yes, exactly. So yes, but in the patient, the understanding of why I'm suffering from this, and the Ayurveda gives a nice, coherent way of looking at the whole person, on the whole life, also the development in the different stages of life, that people say, ah, yeah, that's right. Okay, now I understand. Okay, this makes sense for me. And then they are motivated to act. I think that is, for me, the most important thing. Whatever diseases or whatever symptoms I'm confronted with in the patient, if I'm able to give the patient the understanding of the sequence of the interdependency, already half of the healing is done.
Yeah, because you're giving the consciousness. Yeah. And so, but you talk about the 6 steps or 6.
Yes.
Okay.
There's a sequence of 6 steps, which then the last one is the manifestation of the disease, or even giving side effects. Like in the diabetes, the disease is the problem with the sugar and losing the sugar. This would be the symptoms, and losing and then the side effects are, this neuropathy, this tiredness, all these kind of things. So this would be the last step, and to revert this is not so easy. But to revert, if someone just starts to have a diabetes, and today we have nice measurements like the HbA1c, it's a perfect tool to see whether someone has a diabetes or not, and especially when someone obese comes, and and then the first thing I do, I also work with this. I say, okay, please, we make an HbA1c test, and then we see where he's already there, and then we say, look at this here, you are already at risk, so you have to do something. So that is. So I'm also, as a medical doctor, also I combine also modern approaches, and it helps.
Yeah, of course. I mean, you have both knowledges, so yeah,
yes.
it's a good thing. Yeah, good. Yeah, I think, just, I mean, of course, there is much more to talk about this, and yeah, me and Marco and Joanna, somehow we are also trying to do kind of creating some events or something about health in different areas.
Yes.
And one area is diabetes, because of course this is also important for me.
Yeah, I understand.
To take care, and in fact we want to give not the regular information to people, but help people to go beyond what they usually know, the modern culture usually says. So if when we decided, I mean, which is how to do that, maybe you can also be a good person to talk about it in different ways.
Yes. Well, I'm happy to contribute and to give a speech there, and to give also an introduction to Ayurveda and the doshas and the dushas and the srotas, all these basics which maybe are important to understand the pathophysiology of a disease, and then go through the 6 steps of the pathophysiology in diabetes, type 1 or type 2. So that's something that is possible.
Nice to know. Yeah. So yeah, I'll stay with that, and because we are preparing this year and preparing the things that we really want to do related to this healthcare area, and so we'll keep in touch, and
yes,
I'll come back to you if we need more information, and yes, and I'll look more about what is these 6 steps, because I don't know, and finding out more, because I also want to put the things that you said in my ebook. I want and give more perspectives, because I want to give possibilities for people who can heal to choose what is my path.
Yes.
Because there are different things, and people maybe can go and this is a thing that I didn't try, so you can come and connect, and and you can. I will ask you in the WhatsApp your website.
Yes.
Also, I can put it there, kind of saying, okay, this is the talk that we have about this. This is Dr. Claudius, and you can see him here. Yeah.
Yes, for sure. Of course. Yes.
Yeah. Yeah. So I'll.
Okay, yeah, I'm sorry, I cannot give you like a easy answer. If you have type 2, you do this and this and this. It really depends very much on the person. But what I can really say is that in type 2, in most cases, we can really improve the situation significantly, even even reverting the things when we are early. In type 1, it's more about let's say like living with it in a good way.
Yeah.